First at 5:30, health insurance hurdles, sticker shock hitting families where it hurts right after the holidays.
The Affordable Care Act subsidies just expired, sending premiums going higher. On top of that, prescription drug prices are jumping, and more than 350 medications got more expensive overnight. We're talking everything from vaccines to cancer drugs, and very few drugs are seeing any cuts at all. For many families, it's coming down to any, or rather an impossible choice: pay up or go without coverage. Today, I sat down with a Metro Detroit doctor and a patient to hear how people are coping with this healthcare crisis.
It's going up as far as, health insurance, food.
Do you see more people using emergency rooms instead of seeing doctors if they don't have health insurance?
Yeah, you see a lot of that, or urgent care for like myself.
As a patient, Bridget Fields says there's now an increasing pressure to cover costs associated with medical visits due to the Affordable Health Care Act subsidies running out. The move not to renew them at the federal level also on the radar of Dr. Ali Shueto, owner of the Heights Urgent Care in Dearborn Heights.
Try to really feel for what our patients are going through.
He says with millions potentially being unable to afford health insurance, he expects more people to rely heavily on ER visits and urgent care. In his case,
patient signature.
Cash options for payment have felt like a lifeline for some.
10 to 15% of the whole day, we have patients that come in that are cash pay patients or do not have health insurance.
At his clinic on Telegraph, he says patients are still getting the same level of expert care, but are able to avoid what can be a steep cost for premiums. I also visited other facilities, hearing more of the same concerns from patients, particularly those needing treatment.
A lot of people are not employed anymore or can't afford it or don't qualify for Medicare programs or Medicaid programs and government-funded programs. So a lot of people feel like, I need to put food on my table, or do I need health insurance?
Another factor, according to Fields, comes down to practicality, along with affordability, while still prioritizing health.
Urgent care is a little bit more, it's not as busy as emergency.
The doctor says it is always crucial not to ignore your health. Now, I did reach out to federal lawmakers on both sides today who plan to spend more time addressing these issues. That will continue next week when session resumes.
And Simon, you mentioned it, they're neglecting our health a bit. Is the doctor is he worried people are doing that?
He is worried that people will just stop going to the doctor, stop seeking treatment altogether. He says don't do that because something can really spiral out of control. You got to keep up with your health one way or another.
Very important. Thank you so much, Simon.